Why did I become a dentist? Just so that I can have people shit all over me every day. She stormed out of the office, and then she made sure to dramatically spin around and yell at me, delete my chart, and cancel the rest of my appointments because I'm never coming back here.
Imagine already feeling like you don't belong and then being reminded of it every single day. Your environment can make or break you and your love for the profession.
But then I realized it's not the dentistry, it's the surroundings. And so once I separated the two, it became really clear that I didn't need to leave the profession, I just needed to leave that practice.
You can compromise on a lot of things for your job, but you need to work in a place where professionalism, empathy, and teamwork are the norm.
Welcome back to Project Confidence, the podcast where two dental besties unpack the messy, magical, and sometimes maddening parts of our profession. I'm Dr. Diana Nguyen.
And I'm Dr. Amrita Patel, and today's episode is called I Hate This So Much, Times We Almost Quit Dentistry and Why We Didn't.
That's right. We're talking about those moments, big or small, when we seriously questioned if we made the right career choice or wondered what our lives might have looked like if we'd walked away.
Because if you've ever cried over a plastic tooth or a patient Yelp review that kept you up at night, you are not alone.
All right, Omri, what is your first memory of thinking, oh crap, this is not what I signed up for?
The first day of D1, if I'm being totally honest.
You're joking.
Nope. I got to the lecture hall early, NAGO, looked around and thought, I definitely don't belong here, and I really don't want to be here.
Are you sure you weren't in one of those rooms where they kept all the plastinets?
Oh God, if I had been, I probably would have quit then and there.
We should probably explain for the non-NYU people out there.
Right, because most people had traditional cadaver labs.
So for anyone who's never seen them, plastinets are these preserved human body specimens that were pre-dissected by professionals, where all the water and fat have been replaced by this sort of silicone polymer. I'm not sure what it's called. And so NYU Dental School was unique in that this is how we learned gross anatomy, rather than having to actually cut up a dead body that had been donated to science.
So they don't decompose, they don't smell, and you can literally hold a real muscle, nerve, or vessel in your hands without gloves, because it's basically like touching a super detailed anatomical model that used to be real.
That was actually a major selling point for me in choosing to go to NYU because I was dreading having to dissect a real cadaver.
Oh, me too. So anyway, I get to this very depressing lecture hall, and I actually turned to leave, got as far as the elevator, and then our friend Tamara walked out and introduced herself as Tamara, which rhymes with camera. I knew I'd made a friend, so I stayed.
I mean, who could walk away from Tamara and that Disney princess hair of hers?
It's impossible.
You know, there's this episode of Gilmore Girls, I don't know if you watch it, in which Paris Geller tells one of the main characters, Rory Gilmore, that she looks like little birds help her get dressed in the morning. And that was honestly the exact same thing I thought of Tamara when I first met her.
Oh my God, that's so true.
So that's it, though? You thought of quitting for, 60 seconds? And then Tamara's hair convinced you to stay, and then the rest is history?
No, the next story I have is about almost quitting. You'll definitely remember because it involved a lot of crying, a lot of burnt plastic teeth, and a lot of hand-holding.
All right, everyone. Get in the time machine. Set it for 2007 and the 11th floor of NYU Dental.
You want SimLab, baby.
I knew it.
That whole experience was a nightmare for me. It felt like everyone around me, Mustafa, Julian, Steve, Manny, just got it instantly. And then there was you with your perfect preps, steady hands, coming over to draw lines on my tooth so I'd know where to cut.
I remember that, 2 minutes before a practical starts, and I'm there with my little mechanical pencil. Okay, just listen, just follow the line, okay? Calm down. You're gonna be fine.
Those days and nights were so hard. I felt like I was letting everyone down because I just didn't get it right away.
And I keep telling you, nobody gets plastic teeth at first. There's nothing natural about drilling inside a mannequin's head. It's actually kind of creepy.
So, I thought maybe I should just quit. But, what's funny is I went to dental school for my dad. I wanted to be an Egyptologist, and my mom was like, no daughter of mine is digging around in the desert for a living.
I mean, I say this out of love, obviously, but I can't picture you digging around in the desert either. But it's never too late. You could still do it.
Oh, trust me, there are days where I'm still tempted to do it.
We all have those days in dentistry.
And honestly, I've had a lot of self-doubt moments, but the one that stands out most was when I relocated to the Midwest. Moving to South Dakota made me want to quit clinical dentistry in a way that no New York stress ever did.
I think there are probably going to be people listening to this who are going to be like, okay, so why would your zip code matter? Aren't teeth the same no matter where you go?
Honestly, that's what I kept telling myself too as I was packing my bags and preparing to move away from the only home I've ever really known.
I mean, at the time, I honestly don't know which part of that announcement was more shocking to me and all the other people who know you well. The part of you actually leaving New York, which is so much a part of your personality and identity, or moving to a state where most of our credit card statements come from. I still remember when we were in dental school, you wouldn't even go to Brooklyn.
That's right.
Okay, so tell us why it was hard to be a dentist in South Dakota.
Imagine already feeling like you don't belong and then being reminded of it every single day.
What, like in the office or out in public?
Everywhere. So there aren't any dental schools in the state. So most people who practice are coming home, much like my husband, or have deep family roots. And so there was a sense of like, you're a dentist from New York? Why are you here? What reason do you have for coming here?
And the reason because I married this amazing guy and he practices here and his family is here wasn't what, like good enough?
Apparently not.
I mean, in New York, like the exact opposite happens, right? Like it's a giant melting pot of cultures and ethnicities, and like half the people walking down the street came from somewhere else in the world, not just different states. So, yeah, I can understand how that must have been total culture shock for you,
Oh, totally. It became really isolating because everywhere I went, there seemed to be this total lack of diversity of thought or community.
which is crazy because that's what your entire upbringing and education until this point was about, right?
Yeah. And then the dentistry. I went from the comfort of my family business to the wild, wild west of care.
The one thing I do know about your offices in Westchester is that you guys are so by the book. I mean, between you and your dad, if I ever had a question about an employer and like what they were doing to pressure me or how something needed to be coded, I would just call you up. Do you remember? And I'd be like, hey, Omri, is this legal? And then you guys would be like, obviously not, because there's 12 different ways in which they're deviating from the standard of care or committing fraud. So no, don't do it.
Exactly. Every year, our practices in New York invest an insane amount of money in all the CE to stay up to date on making sure we're following the latest scientific guidelines and billing and coding properly so we don't get a bunch of insurance denials. And we're always trying to provide the safest and best care.
Of course.
So then I'd find myself in these practices where, like, it was very clear the staff thought I was being demanding for wanting to do my pulpectomies under a rubber dam.
Oh, sacrilege.
Right? Or just letting patients do prophy year after year because that's all the insurance would cover. And they just wanted to get these people in and out as fast as possible when they clearly needed deep cleanings and fillings and some extractions. But then when I'm the only one saying these things or, telling patients these teeth need to be fixed or come out, everyone looks at me like I'm the bad guy.
Ah, yeah. Supervised neglect. The worst.
And if I defended myself, you know what I'd hear? Well, they might do things differently in New York, but around here,
Ooh, that makes me so mad.
it was infuriating. Because I'm an educated woman with a doctorate, I did a residency, I run multiple successful practices, I teach CE courses.
And yet, here you are, you're being gaslighted into thinking that you don't know what you're talking about.
100%. That's when I realized that your environment can make or break you and your love for the profession.
I'm really sorry that you had to go through that. But if it's any consolation, I think that there's probably a lot of people out there listening to your story and thinking, oh my gosh, like I thought it was just me. And I've totally been there too.
I really do hope that sharing my story helps someone else because I would never wish that feeling on another person. But in a way, hating my day job led me to lean into all the other ways I could use my experience and degree, like speaking and writing and connecting with people outside of my tiny little Sioux Falls bubble. And that's largely why I have the career that I have today.
I don't think there was really one distinct memory of wanting to quit dentistry when we were in dental school because I don't know, you probably remember, but I was so emotionally volatile during this time of my life that I couldn't point to a specific period where I said, oh, I'm just going to quit dental school and move to the Jersey Shore and we can sell t shirts and ice cream on the beach. I just felt like I was this emotional yo yo for all 4 years, just kind of up and down and up and down.
That's such a good analogy because I definitely felt that way too.
Yeah, like on the days that were good, and then, I aced a practical, or I inserted a crown that fit perfectly on the first try, or I delivered a denture that made the patient cry. It was tears of happiness because they finally had teeth after all this time. It was like the ultimate dopamine hit, right? And I was like, yes, I was born for this. I am so good at this. And then when I failed an exam, or got really harsh criticism from faculty, or had a really bad patient interaction, then the lows felt so low. And I didn't have good coping mechanisms for getting through.
It's something that I think is really hard to explain to people outside of dentistry, how crushing it was to fail at something when you're in school for it.
Right. And I would just cry and feel sorry for myself and want to lock myself in my room. And I would just want to wallow in the misery of making what I felt was a really bad life decision by choosing this profession. And so that's something that I'm really so attentive to when I teach now, because I can kind of spot those students who've sort of mentally or emotionally hit a wall. And I can see that they're, over dentistry. And I focus a lot of my coaching and mentoring on being honest about how, you know what, guys, it's not always going to be as fun as the dental influencers on Instagram make it look.
Instagram came out like the year, I think, after we graduated. Do you ever wonder what life would have been like if we'd had it when we were still in school?
I actually think about that a lot. I wonder if I would have felt the pressure to post a lot of happy pictures just to keep up a facade that everything was going great. Like my life as a dental student was just this 24-hour figs ad.
And, I think social media is dangerous in that way. We talk about this a lot. Totally fabricated and filtered. And yet it's set up to make you feel like that's what your life should be like all the time. And if it isn't, then you must be doing something wrong.
Yeah, Oprah Winfrey said in a speech that she gave at USC a few years ago that, your job isn't going to always fulfill you. And I think the exact quote is, there will be some days where you might just be bored and other days you might not feel like going to work at all, but you should go anyway. And that really resonates with me so much because our generation grew up with these mantras like follow your dreams and find something you love and you'll never have to work a day in your life. Looks really cute stitched on a pillow, but is incongruent to how we are also expected to grind nonstop towards success.
But hey, now you're the person your students go to when they hit that same wall.
Yeah, the first time I almost quit pursuing dentistry, though, was when I was a pre dental student.
That far back?
Yeah.
Oh,
So, not a lot of people know this, but it was when my father had a heart attack when I was still an undergrad. It was a few weeks before I started my sophomore year of college.
oh man, I don't think I knew that.
Yeah, this was before we met. You know everything now.
That's very true. I know all the secrets, and that is why we will be friends forever.
Yeah. So, anyway, while my dad was recovering, I had the opportunity to spend some actual quiet, slow time with him at his bedside and at home, which is something I honestly hadn't done much of as a teenager and in my young adult life.
Okay.
My dad and I, you've met him, we're both very similar. He was a cardiothoracic anesthesiologist at a major medical center in New York, and he was an extreme overachiever and had this very strong, immigrant work ethic, like always working late, always taking the tough cases, always working with residents, which honestly was one of the things that he loved the most. And I know that his residents adored him too.
Like father, like daughter.
Oh, for sure. His faculty evaluations every year were like, everyone loves Dr. Nguyen. And there is a part of me that takes some pride in trying to reproduce that same fun atmosphere in the work that I do now.
Your students are crazy about you. I even know pre-dents who follow you on Instagram who say that your teaching where you are right now factored into their decision about where to apply.
That's so much pressure. I mean, what if they get here and I don't live up to their expectations?
Let's go back to the senior Dr. Nguyen.
Okay. All right. Back to the story. So, anyway, I always had a great deal of respect for my father, but I was your stereotypical firstborn daughter of Asian immigrants, right? Like overly scheduled with extracurriculars and leadership roles, high honor roll AP classes, piano lessons, laser focused on getting into an Ivy League school, all that. And it was like, okay, as soon as I hit puberty, my bond with my mom got a lot stronger, but then my relationship with my father was like, oh, like he can't relate. Like I have girl issues. I can't talk to him about like my period and boobs and acne and having a crush on a boy.
I 1000% identify with everything you are saying right now. I lived it too.
I know that there are women listening to this pod who are being like, what are you talking about? I share everything with my father. My dad is my best friend. And I have always envied those girls in a way.
My husband and his daughter are like that.
See, like that's what I'm saying. But daughters of Asian fathers, no. Like, when would you ever talk to your father about that stuff? Never, right?
Never, not even now.
So anyway, with my dad finally being forced to take time off of work for his medical leave, like I remember distinctly that he was sitting upright in his bed, trying to relax and rest. And then he actually asked me for the first time, like what I wanted to do with my life, which in retrospect is kind of wild because he was paying for me to go to Columbia, right? And I was about to go back for my second year. And then really, like this is the first time we've ever broached the subject that I can remember.
Did he just assume you were going to go pre-med because, hello, Asian? I can say that because, hi, Indian.
Yeah, I think at some point my mom had shared with him that I was exploring this, pre-dental option. But I was really on the fence because I had bombed my first semester of biology in college. And then, when you go from being a really standout student in high school to really struggling in college with this literal sea of geniuses and valedictorians, imposter syndrome hits you like wham. And then you start thinking, okay, maybe I'm not meant to do this. Like maybe I should look into law school or publishing or PR. I don't know, whatever the careers of the women in Sex and the City were doing. Like HBO did such a job of glamorizing that at the time.
Oh, yes, this era.
Yeah, so I remember telling him, well, I thought about going to dental school, but these science classes are so hard and becoming a dentist is going to be hard. And I don't know, maybe I should do something that would be easier. And I remember he paused for a second, like he didn't even flinch or seem disappointed or angry, which I remember almost bracing myself for. And then he just quietly responded, you know, you should only not do something if you really don't want to do it, but don't not do it just because you think it's going to be hard.
That is entirely not what you would expect an Asian dad to say.
Exactly. I really expected like, oh, if you don't become a doctor, you're dead to me. And I found myself thinking like, man, I need to give this guy some more credit because I can't tell you how many times I have over the course of the last 20 something years had to actually repeat that as a mantra to myself. And it's really helped me make a lot of pivotal decisions in my life and career. Like, should I do residency? Should I stay in my current relationship or start over? Should I specialize? Like, should I open my own practice? Should I have a kid?
Totally.
So the second time I almost quit dentistry, I think I was 1 month into my residency program at Yale.
That's pretty early on, too.
Yeah, I got called in for some kind of facial trauma in the middle of the night. Like, I can't even remember what it was, but our protocol was that if you felt like you were unequipped to handle the nature of the emergency, then you had to page the oral surgery resident on call so that they could talk you through what to do step by step, or they would come in and help you out because Yale has this 4-year OMFS program as well.
Oh, yeah, we had a similar setup for the first month of my GPR, too.
Yeah, a lot of programs do this, and so that you don't have to face your first call experience alone because that can be really scary and traumatic.
Tell me about it.
So I had done my fair share of extractions, right? Getting people out of pain at NYU, and I was also like very, very used to how supportive our NYU oral surgery attendings are. I mean, don't get me wrong, you remember, they're tough as nails and they get the job done. But one of the things I loved was that they were always there to guide you and lead you to the right decisions when you were unsure of yourself. So it wasn't like I didn't know how to figure out if a patient needed to take a tooth out, but Yale was this level 1 trauma center, and there was some seriously scary stuff coming out of that ED late at night. Like I saw gang violence, motor vehicle accidents, like major stuff.
I mean, it's New Haven, which can also be kind of rough in some areas, and especially at night.
Yeah, yeah. So this call at Yale, whatever it was, I remember being like, I don't have a clue what I'm supposed to do here. I'm just going to call the oral surgery resident. Guys, he was so cranky about me calling him. He was like, how do you not know what to do? Like, why are you calling me right now? You don't even know what you're looking at. Like, I do not want to come in and help you right now.
What a jerk.
Yeah. And I was like, I don't know what to tell you. I'm totally new to this and I am freaking out. Like, I need your help.
And also, you were completely new to this. He should have been more sympathetic.
In retrospect, like, I'm sure he was just sleep deprived and was maybe super stressed out from getting paged all night or something.
Yeah, I mean, I've seen these guys. They would carry like 5 pagers from 5 different hospitals in the area.
Yeah. So I get it. And like, the last thing that you want to do is go back into the hospital at 1 a.m. to hold my hand through a procedure that is probably stupidly easy for you. So I don't even remember what we did. Like, we probably just splinted some guy's teeth in place or something. But what I do remember is that I later found out that he was going around and telling everyone in my program and his program that I was, quote, like literally the dumbest person he'd ever met.
Oh, hell no.
Yeah. So I just remember being completely crushed by that. And I was so fixated on everyone having heard this guy's personal assessment of my self-worth that I walked around in this mental fog for days after that. And then I seriously considered dropping out of the program, just pack up my things and just going home.
I remember those phone calls. I hated that guy for you so much.
Yeah. And so I ugly cried to my program director about it in his office a few days later, like full on broke down sobbing in the middle of the day. It was so embarrassing. And what I remember him telling me was, Diana, you're going to have to develop a thick skin for criticism and other people's opinions of the quality of your work and what you can do if you want to survive in this profession. And he said, I think you have a lot of potential to go really far and be a leader in the dental profession. But if your career is going where I think it's going, then you're going to have to get used to people saying things that aren't true.
I mean, how incredibly kind.
Totally. This advice was golden. And not only was it exactly what I needed to hear at the time, but I've come back to it probably 100 times since then.
Yeah, because it applies whether you're staring down a 1-star review from a patient or whether you're dealing with a bully at work. There are always going to be people who want to focus on what they perceive to be your deficiencies or imperfections or even your failures. And the best way to power through that is to keep showing up every day, working on yourself for yourself and delivering your best.
I'm going to bring up Oprah again, who said, become so skilled, so vigilant, so flat out fantastic at what you do that your talent cannot be dismissed. And so now that's the energy that I try to bring to my work every day.
No wonder she's a billionaire.
The third time I almost quit dentistry was when I was working as an associate in private practice.
Was this a lot later?
No, this was relatively early on in my career, maybe a year or so after I finished my GPR move to San Diego.
Go on.
So I had treated this patient that wound up having a, less than favorable outcome to the treatment we recommended for her. It was one of those cases where she had like really deep caries on a molar, and we told her we were pretty sure it's going to need endo. And of course, she wound up needing molar endo, right? And having to pay for that. And then she had to come back and get a crown after that. And then there kept being issues with the crown. Like I think this CEREC machine malfunctioning the day that she was there, so much longer to finish it. And then she wasn't happy with the crown and just kept spiraling and spiraling like that. And so like no matter what I said or did, there was no convincing her that we had done everything we could to help her and that it was just done to the standard of care.
I mean, we all have stories of patients like that. Those are some of the hardest to get over, I think, because you know in your heart that you didn't do anything that another perfectly reasonable dentist in your shoes wouldn't have done.
Exactly. And so we offered her more consults and referrals to specialists. And then finally, one day, after the end of like another appointment that had been made just so I could sit down and explain to her again that I had done everything that I could, and it just turned into this dramatic showdown. And she just screamed at me for being incompetent for 20 minutes straight.
Oh my God, what did you do?
Oh, wait. No, my story gets better.
Seriously?
Yeah. So she stormed out of the office and then she made sure to dramatically spin around and yell at me, delete my chart and cancel the rest of my appointments because I'm never coming back here. And by the way, you're a terrible doctor.
Oh, Jesus.
Now, not only was this obviously really hard to hear as someone who was still technically a new dentist, but then there were two other things that happened in association with this that made me so upset and frustrated that I was like, okay, I'm so done with this job. Like, I just need to do something else with my life.
It gets worse?
Yeah. So number one, the office manager at this practice and I were not getting along for a number of reasons that I'm not going to get into here. But afterwards, seriously, what office manager allows a patient to scream at anyone about anything in the practice for more than like 2 minutes before immediately entering the room and trying to de-escalate the situation, right?
I mean, that's their job.
And do you know what the office manager was doing instead?
Please tell me she was just too busy at the front or on the phone or with another patient?
Oh no, she was, I kid you not, standing outside my operatory with a bag of popcorn, watching it all happen. And she was literally that Michael Jackson gif of him watching a movie and shoving fistfuls of popcorn into his face.
Oh, hell no.
Like, she must have been so giddy to get to watch a patient just completely rip me apart, and she did nothing to help. Just let it all burn to the ground and let all the other patients and staff in the office hear what was being screamed about me.
Please tell me she was fired after all this?
Oh, well, that brings me to the second thing.
Of course.
So I reported this to the owner of the practice, and she just shrugged it off. And she said, whatever, that patient was crazy. It's good that she's not coming back.
That's it?
Yep, no empathy for how I might have been feeling, not just about the harsh criticism from a patient and getting screamed at, but also no acknowledgement that the office manager not only wasn't doing her job, but was just standing there and enjoying the show the whole time. And I remember driving home that evening in tears, like just gripping the steering wheel and just crying my eyes out, like calling my friends in San Diego on the road and being like, guys, emergency meeting, the bar stat, like I need to drown my sorrows in some very strong cocktails and a plate of pasta.
That is so horrible.
I know. And at first, I was like, why did I become a dentist just so that I can have people shit all over me every day? But then I realized it's not the dentistry, right? It's the surroundings. And so once I separated the two, it became really clear that I didn't need to leave the profession. I just needed to leave that practice.
Right. You can compromise on a lot of things for your job, but you need to work in a place where professionalism, empathy, and teamwork are the norm.
Correct. So that experience taught me that being a good dentist doesn't mean you should just put up with being a punching bag. I learned you got to walk away, breathe, and then debrief with people you trust instead of internalizing all that chaos. And it was really a turning point. That day taught me boundaries, self-compassion, and that success isn't about everyone loving you. It's about maintaining your integrity when others lose theirs.
Well, I think the thread through all our stories is that quitting usually isn't about hating dentistry, but it's about hating the circumstances. And when you change those circumstances, the love can come back.
Exactly. Every dentist has their I hate this so much moment. But if you can pause long enough to ask, do I hate the work or do I just need a little time out to reevaluate where I am and what my priorities are?
And to anyone listening who's in that place right now, don't make a permanent decision based on temporary burnout.
Right. Reach out to your dental and non-dental friends to get some clarity and perspective.
And if you've ever had a moment where you wanted to throw your handpiece across the room, we see you. And you can always come and sit with us here at Project Confidence.
Don't forget to subscribe, share your own I hate this so much stories with us on Instagram at Project Confidence, and we'll see you next time.
Bye.
Bye.